Sponsored by Stubbs Dental Implant Center. Are you missing a tooth or more? Not sure what your next steps should be? Well, Dr. David Stubbs is here to share the best fit for you. Welcome to the show.
Thank you. Thanks for having me.
We're talking dental implants and what the benefits are. Can you tell us about what they are?
Yeah, so dental implants is when we lose a tooth and we need a space filled. We'll put instead of having a tooth root, you put a titanium screw in that space and put a tooth on it, basically. And it's self-sufficient. It doesn't require cantilevering or attaching the other teeth, so it's a long-lasting procedure.
Fills the gap and it's long-lasting.
Yeah.
It's solid for sure.
Yeah.
Now there's a dental bridge. What is that? What are the benefits of it?
So the nice thing about a dental bridge, it's more immediate. So with an implant, usually you have to wait a couple months or a few months for it to heal.
Okay.
But with a dental bridge, you crown two teeth next door, and you put a fake tooth that's attached to those two teeth next door, like in front and back of the space.
So it anchors them,
yeah.
It holds them together. Like you can see
Yeah.
some of the pictures here that kind of show what
Yeah.
that looks like. There's different types of dental bridges, though, is what I understand.
Yeah.
Can you explain what the difference is?
So the problem with teeth bridges is after about 10 years, 15 years, they can fail on you because the teeth do so much work. It's doing two teeth are doing the work of three teeth, basically.
Gotcha.
But with implants and implant bridges, as you see some of those pictures are implant bridges, those implants are made to carry that load, and so they last. They stand the test of time, and they do really well over those periods of time.
That makes sense. But this differs from a traditional bridge. How so?
Yeah. So implant bridges are made of titanium, zirconium, whereas teeth, they can decay underneath. So when you do a tooth-borne bridge, after a while they wear and they break. Whereas with implants, those last, those stand that test of time. We have to still keep our gums clean and things like that.
For sure, yeah.
But it's something that patients can really have confidence in.
Well, speaking of patients, who would you say is a good candidate for a dental bridge?
So anyone for either implants or dental bridges or implant bridges, anyone who's missing teeth or their teeth are broken to a point where they can't restore them. So they can't save them, they can't replace or do a new crown or anything like that. So if you've been told that you're losing a tooth or that you've already lost a tooth, you're a great candidate for this.
So those that are watching, just to verify, how can we know if we're the good candidate?
Yeah, so if I go, like my crown broke or something like that, right? Or my filling broke and the doctor says, hey, we can try to save this, but they don't look really confident, like, it may not last if we do try to save it.
Sure.
That's when you start thinking, maybe I should consider doing a dental implant or something like an implant bridge, something like that. So. And
the best way to know is to go to the professionals that know what they're talking about.
Go to someone who does implants. This is really important.
This is what you do. You've done this a long time. So where can we go for more information about the practice?
You're welcome to go to stubbsdental.com. We offer consultations. We also do stuff digitally over online, so we can have conversations that way.
Yeah.
One of our treatment coordinators sometimes will even call if you need conversation, not time to get into an office. But the best way is also just to get in for a consultation.
There's a number to call, website to go to, and you can listen here. So thank you for that information, Dr.
Thank you.
Stubbs.
Appreciate
Great to have you.
Yeah,
Good luck to you. Thanks so much.